Hi everybody, it's Donna Mechura with Berkshire Hathaway Home Services, PenFed Realty, and today I am over at Advanced Eye Care. And I want to ask you a question. When's the last time you had your eyes examined? Right? Probably recently if you wear glasses like myself, but how about if you don't wear glasses? Probably think, why bother? Is it really that important? Well, this interview today is so incredible and important for you to get this message because Dr. McConkey and her client Mason I'm going to interview, and they're going to tell you how life-saving this eye exam was for his life. And it's really on a more serious tone than I usually document, but I think it's an important message, and I really want you to understand just how important it is to get your eyes examined. So let's go in and meet them and find out more about their story. So here we have Dr. McConkey and her client, Mason Class, and they're going to tell us basically what happened to Mason. I mean, you just walked into Dr. McConkey's office one day, a regular routine exam.
Right.
And you got the shock of your life.
Exactly. So came in picked the name out of a book. Came in for my yearly eye exam because I'm diabetic, so I have to get examined every year. No symptoms, just a regular eye exam. Nothing was bothering me. Just come in, and she tells me after, she says, by the way, you have dry eyes, there's a freckle. And being the type of person I am, I kind of laugh about it because that's just the way I am. And then she's actually said, no, it's raised like any other freckle. That's a very concerning thing. And she basically says it's cancer, but I need to consult with somebody else and we'll get back to you. Of course, my heart sunk, my stomach was in my throat. I left here crying.
It's the last thing you expect to hear when you get your eyes examined.
Exactly. I've been in the medical business for 26 years, and you just don't hear the word eye cancer.
Right.
It's not something you expect at all. And I literally was lucky to have walked into this office at this moment because less than a year ago, my eyes were fine.
Wow.
And like I said, I had no symptoms, but the last eye exam, they didn't say anything was wrong.
Right.
Except for normal changes in my vision.
Right.
So it was a complete shock to me.
So Dr. McConkey, when you're examining Mason's eyes, and I mean, what do you first say you have dry eye, but then you're looking at films and you're seeing something different. So
yes.
What are you thinking?
So his eyes were dilated, and it's important to make sure that when you have eye exams that you do get dilated exams regularly, because I would like to think I would have seen it undilated, but it definitely gave me a much better view. So I was doing his dilated exam after he waited 15 minutes after the drops were in, and I was talking to him about his oil glands that have to do with dry eye, and I'm giving him, a kind of a treatment plan on that. And then I kind of stopped and was like, you know what, we're going to put that on the back burner. And we started talking a little bit more, and it's hard to keep your composure in that kind of situation because I knew exactly what was going on, and you have to be tactful about how you deliver this kind of news.
Wow.
And it was the first time, not the first time I'd seen this, but the first time I had to be the person to tell someone. He kind of said, tell me honestly, do you think this is cancer? And I was like, yes, I do.
And so at that point you said, let's send you to the best, right? For eyes, which would be
Wills Eye Hospital, Philadelphia.
Wills Eye in Philly.
Yep.
Dr. Shields.
Dr. Shields.
So, I mean, literally it was the next day I got a call from her office and my appointment was made. And they actually asked me, is that too early in the morning? It was a 7:30 appointment. I said, no, I'll be there the night before because I have never been to Philadelphia by myself. And of course I'm going to go the night before. And, to make things worse, my mother was having a birthday in a couple of days. I have cancer in my family, but not this cancer. Like I said, I've never even heard of this. So it was a shot. And I had just been to see my doctor that morning before I saw Dr. McConkey, and everything's fine.
Really?
And
I have to call her the next day and tell her I have cancer, and that kind of made them speechless. And I said I need a pre-surgical physical, and they're just like in awe. So literally Monday, preliminary diagnosis, which I thought was pretty accurate. Tuesday, I'm back here for pictures. Wednesday, I'm at another doctor's getting pre-surgical. Friday, I'm back here because they're telling me they're going to cancel my appointment because they haven't gotten anything. I'm in tears, and you know, it's not true. They have everything, and I just can't thank everybody here that, you know, she's telling me she's on call. Just call if you need to cry, whatever.
Dr. McConkey.
Yeah, I mean, this was the worst day of my life. I mean, out of all the things that I've cried about in my life, the birth of my children, this is, you know, doing this on my own was just horrendous.
The hardest thing.
Yeah.
But you weren't completely on your own.
No, I wasn't.
You had Dr. McConkey helping.
And her staff.
Yeah. That is such a blessing when you're going through a time like that.
I was in Philly on Sunday, saw Dr. Shields, who, like she said, is the best. She's world renowned. Monday, Wednesday before surgery, Dr. McConkey called me from here. I was in Philadelphia just to make sure everything was fine. And from there, it's just been back and forth between there and here. And the staff has been great, and everything has come out wonderful. But if it wasn't for a routine eye exam, I would have never known I had this problem.
Wow.
No symptoms whatsoever. So, I mean, I can't stress it enough that
you owe your
I owe
life.
my life
you
to diabetes. I owe my life to going in and doing what I'm supposed to do. And
your routine eye
exams and getting dilated, and you know, and all the things that she just recently just talked about, and a little 15-minute exam or whatever, you know, saved my life basically. I mean,
totally. It's something that I don't think we think enough of as far as that preventative care, right? And I think, Dr. McConkey, that was one of your main points that you wanted to come across, was the preventative care, getting those eye exams. You know, it's like, yes, the eye cancer is a rare finding, but, you know, here you are, you had that rare finding, and if you didn't have that examination, you would not be sitting here with us today, probably. Correct. What would you say, Dr. McConkey, as far as, you know, to everyone out there? Like, what's your advice for people like Mason?
So, you know, everyone thinks that an eye exam is just about contact lenses and glasses, and that is just a small piece of the pie. You know, getting a full eye exam for us to look at your eyelids, to look at the eyeball, and to look inside the eye, and people don't like dilation. You know, it can blur your vision just temporarily, but, you know, it's a 4-hour inconvenience where your vision isn't perfect and you're a little light sensitive. But what we're looking for inside the eye, there's actually blood vessels inside the eye that tell us a lot about the whole body. So we can see diabetes, high blood pressure, high cholesterol. Most people are diagnosed with those before we come in. But, you know, we catch blocked carotids, heart disease, you know, strokes. I've had a few patients I've had to send to the hospital because they had signs that they were about to have a stroke. You know, we can catch inflammatory conditions of the blood vessels. We can catch brain tumors, anything going on in your brain. If there's added volume, it has to go somewhere. It pushes forward on the optic nerve. And so a lot of people have blurred vision and they assume that, you know, they just need glasses. We can, you know, catch so many different things. There's signs of colon cancer inside the eye. So sometimes we're running colonoscopies for people.
That is fascinating. So really, the eye care really is your overall health care.
It really is. You know, you can't see your blood vessels anywhere else in your body unless you cut into you. And your optic nerve is an extension of your brain, so it tells you about your nervous system. So it's it's really amazing what we can tell. And you know, I'm just very lucky that he came in and we were able to take care of him. We've developed a really good relationship, and you know, he's a really big advocate now for routine eye exams. And like you said, he had no symptoms, and so just because you don't have symptoms, he's actually not the first of this that I've seen. And while it's really rare, you know, working in the medical field, we see it. And the other patient I had also had no symptoms. And so, you know, it happens in young people. So just because you're young and just because you see well doesn't mean you shouldn't have an eye exam. So I'd recommend every 1 to 2 years. If you've never had an eye exam, get your butt into the eye exam. It's just really important.
Well, I appreciate you both really sharing this story with us, because I just think it's just so important. And I understand you have a very interesting tattoo, Mason. Would you like to share that with us?
Yeah, I would. After all this happened, I felt that was part of who I am. I originally wanted to just get a green cancer ribbon. The young lady that's my tattoo artist said she couldn't do that. She wanted to do something special for me. And she's gone through cancer herself, so we kind of have a close relationship in that regards. And she did this, and everyone sees it and they almost automatically know that it's eye cancer. But green stands for eye cancer, and that's why I have it. And I wouldn't be here today if it wasn't for Dr. McConkey, and I just can't thank her staff and everybody here, because if it wasn't for them, I probably wouldn't be here right now.
Dr. McConkey, how would you like to, how can people get a hold of you? What's the best way to find you?
So we're in Bel Air, Maryland at Advanced Eye Care, Dr. Lisa Floner's practice. If you want to make an appointment, you can call. Our number is 410-459-5320 or advancedeyecaremd.com. We also have a Facebook page.
Oh, yay. So we'll like that. I'll make sure to do that. Well, thank you again. I appreciate your time.
Thank
and
you.
best of luck to you, Mason. Thank you again.